Hello and welcome. I am Bill Satterwhite, pediatrician, but now CEO of a company called Sneez that has to do with illness tracking. That all came about in the context of caring for children. And so I have a special guest today, Dr. Steve Hodges. He is an associate professor at Atrium Health Wake Forest Baptist, and he is the author of numerous articles and books that relate to bowel bladder disorders, which in ordinary words mean a lot of bowel accidents and bladder accidents that are happening in children. And so he and I are here today to talk about some of that. Thanks for being here, being willing to take the time to do it.
Thanks for having me. I appreciate it.
Very much so. I think the first question that I know most listeners want to know is, so what's normal? Like when do kids finally stop needing diapers? Daytime, nighttime? I mean, what's the normal there?
Yeah, so there's a range, as you will know from your practice, that I think most kids probably should start training no earlier than 3. That's my bias, and we can get into that if you want. But I think most kids that are healthy and along normal developmental milestones will be potty trained by 4. And that's like kind of a red flag if by 4 they're not potty trained. But a lot of those kids may be out of diapers, but still having accidents. And the typical age for treating accidents, which a quarter of kids may have at the age of 5, is the age of 5, because they drop off pretty rapidly up until that age because they're probably just getting potty training kind of fine tuned. And then the improvement is about 15% a year after that age of 5 cutoff. And the majority of those kids at the age of 5, 25%, which are wet, is bedwetting, although a small percentage do have accidents while awake.
Okay. And so for somebody who's 13 and still wetting the bed at night, is that normal, exceedingly abnormal?
So I'm very aggressive with bedwetting, and so I don't think bedwetting is aggressive normal at any age. So 13 is, you waited way too long. But there is a time frame between potty training and like the 5-8 weeks where it may not even be clear if they're doing it on purpose because they're in a crib maybe, or can't get out of bed, or afraid to go to the bathroom. So you can give them some leeway. But I think if a child is potty trained, can use the bathroom, can get to the bathroom normally, then wetting at night is abnormal at any age after that. In fact, the father.
So after age 5 as well,
yeah. But even the guy whose research I based my work on treated his own son at 4, and he kind of was fed up with it, and so he developed his system there, and it worked well for him. So, but 5's a good age.
So, what would be the typical causes? I'll use the word pathology. So, what are the pathologic causes of continued wetting accidents, day or night, as you sort of skate into and then past the 5s?
And I'm going to kind of address this towards what we call typically healthy kids, right? Because
right.
Yeah, some kids are born and with conditions where they can't.
Basically, that general, normal, typical child, wide range on what that means, but yeah.
Yeah. So those kids have what we call overactive bladder. So their bladder is contracting uncontrollably, or when they don't want it to, and that is uniformly due to constipation, or what we call constipation, what you might want to call incomplete emptying of the rectum, or delayed emptying the colon, where basically kids put off pooping. The poop accumulates at the end of the colon, which is the rectum, and it sets off a nerve reflex that causes the bladder empty when you don't want it to. And that's been proven repeatedly in numerous studies.
So basically they're full of poop.
I mean, yeah, that's their mom's favorite joke. It's mom's favorite joke in the clinic, especially after the x-rays.
That's right. So they're full of poop. And I guess the other way I think about this is, it's almost like a pregnant woman where the baby is kind of pushing down the bladder, the way all the anatomy is arranged. So in my mind, I imagine that, this 4, 5, 6, 7, 8-year-old is full of poop, almost like a pregnancy, pushing on the bladder, causing a lot of that triggering. And there may be other causes to triggering it too that are connected.
Yeah. So that's the best analogy for kind of people to kind of get an understanding of it. What's really happening, we think, is that how babies pee from reflex, like you have like an infant just peeing on their own. They don't even think about it. They're just peeing. It's all like a sacral reflex down, never getting to the brain. And then when you potty train, that shifts up to your brain controlling it. That stretching of the rectum stimulates nerves that set off that reflex, which explains why these kids don't wake up, why they don't feel it while awake. Because that's the most frustrating part for parents, is these kids will be sitting in pee or poop and they don't even know it. And they're like, how can you not know you're wet? And the kids, they honestly don't.
Wow. Yeah, that's fascinating. So that's a return to the infant state where it just triggers it, and there you go.
Yeah, I think it's like a persistence of a fetal reflex, which or infant reflex, which I guess, lots of other reflexes kind of taper off at certain ages, and some may persist. And I'm not familiar with all infant reflexes, but there's several.
So that's going to be basically just like if the doctor takes that little reflex hammer and has you sitting on the side of the exam table and hits your knee, and your knee uncontrollably, just your leg goes out, right?
Yeah.
Is that
and
same?
That's why, because early on I was like, well, let's just, these kids would pee on themselves during the day. So the logical thing is, well, just go pee every hour, or go pee every 45 minutes. You could take it down to pee every 15 minutes. And what happens with the kids would sit on the toilet, they would not pee because they didn't have to. They would get up and have an accident because it was a reflex. It's like a sneeze. It's not like a volitional act.
Yeah, or blinking, blinking. I remember getting contact lenses. It used to take me 20 minutes to put in a contact because I kept blinking no matter how hard I tried not to,
Yeah, I still can't touch my eyes. There's no way.
I mean, it's the same thing.
Yeah.
Well, this has been great. Thank you so much for taking this time. We appreciate it very much. Any other last words of wisdom?
I would just say that accidents in children are never their fault, but they're never normal. So I encourage parents to get them evaluated by a physician, and you can get them treated.
Excellent. Thank you very much, Dr. Hodges.
Thank you.